On the video side at Sutter Health, we're really trying to leverage moving people in one way or another. Sometimes it's internal employee audiences to motivate them, to inform them, to educate them, to get them to do what we need them to do from a strategy standpoint in order to make good on our partnership promise, which from a marketing perspective, our tagline is "We plus you." We really partner with our patients to give them personalized, high quality care. So how do we do that? We're showing them patient stories. We're showing them videos of teams working together. We're showing different learning and technical strategies that they can take advantage of in order to do their jobs better. And on the external side, I suppose both internal communications and external communications. On the external side, we're using video a lot to inform our audiences about our services. We have 50,000 employees. We've got over 50 hospitals and surgical centers. We're a not-for-profit organization, so that's an important story for us to tell in a public space as well, because a lot of people see us as a very large organization with lots of resources, and healthcare is very expensive, and why do you charge so much? And then, some people just don't know that we're a not-for-profit organization that reinvests anything above and beyond our expenses back into our communities for new facilities and things like that. So we have, on the external side, a good example might be how we have turned our annual report to our communities into a multimedia experience in order to influence and inform our consumer audiences, reporters, those kinds of things. It used to be a PDF version. Before that, it used to be a hard copy, printed publication, very expensive, very labor intensive. Then we started to segue into online PDFs and things like that. Then we went to an all multimedia experience that is primarily video content and short blurbs of text and background information, and it just tells our story much more emotionally, much more emotional and deeper connection for folks when they can see these stories in what essentially are mostly short form videos. Most of what we do, we get about 2,500 videos in our library, are probably I would say 2 to 3 minutes long for the most part. We engage in many levels at Sutter Health with regard to our video strategy. For example, social is a space that we've been very active in, and our social media team is in the Twitter world, in Facebook, we're on YouTube, and we found that a lot of folks will ingest that kind of information, whether it's information that helps solve their immediate problem or, again, helps us as an organization sort of spread the word about our services to entice people to come learn more about us and to take advantage of our services. Another way that we have found that the video is making inroads and helping build our business is we have started to do physician profiles, philosophy of care videos with our physicians. So we have a roster of almost 5,000 physician providers across our network. Well, how do you make that choice if you're a consumer? Especially in such an intimate relationship like picking your primary care doctor. And so we started with basic information. Where did the doctor graduate school? What are their specialties? What is the address and contact information? And then we started putting up photos, right? So you could see what your doctor looked like before you made that choice. Well, now we're taking that a step further so that when somebody goes to choose their provider, they can watch a minute and a half video, hear the voice, see the face, get an idea of what that bedside manner of that physician might be, in hopes that that motivates them, brings them closer to the care provider, know that they really have a partner in their health care. So I think that video is a great opportunity with regard to trying to help folks navigate and better understanding of what the impact is of the Affordable Care Act, right? And so many main principles of the Affordable Care Act kick in 2014. And I think for folks, and we're based in California, and they have set up a state-run healthcare exchange to try to bring those folks who are not insured onto the healthcare rolls. And a lot of folks aren't going to know how to navigate that. Where does our organization fit into the space in terms of a healthcare provider? And so I actually see video, especially short form video, that is informative and is maybe even a little less self-serving than you would think about a traditional video just trying to build their brand, but more about helping people understand how to navigate the education process of the healthcare environment, I think is a great opportunity for us. And then also engaging our employees through use of video and through training, trying to tell them how they can help connect the dots between delivering more affordable care to more people with limited resources moving forward. And a lot of times doing that through anecdotal storytelling or breaking things apart and expressing it in video, it's just much more engaging than if we send out an executive memo or something along those lines. We are a large not-for-profit healthcare system based in Northern California, and the big thing for us is how do we communicate? And we have been very good at communicating across many platforms for many years, but as of about 5 years ago, we didn't even have a video presence in corporate communications at our home office for a company with 50,000 employees. And so we really got into the video space very proactive within just the last few years, and we've just seen it grow exponentially. We've probably produced 2,500 short-form videos to support internal and external communications across our whole environment. So we are moving at a very rapid pace to try to figure out what solutions we need to focus on. You know, mobile is certainly big. We have ADA compliant websites and need to be able to deliver up video in an experience that is conducive to all members of our communities. So all of those strategy items are on the forefront for us right now at Sutter Health. And the big thing for us is how do we continue to find ways to deliver this technology because people want it this way, but we're a healthcare service provider. We're not a tech company, we're not a video publishing corporation, but we are. And so we really have to lean on some of these third-party partners to help us get this technology in place. And that has been the value for us in like our Brightcove partnership and some of the others in the Brightcove ecosystem.
An unlimited number of programming channels would emerge from brands and from media publishers that would distribute that content directly to televisions in the living room over the internet without the traditional methods of broadcasting, cable, and so forth. And that was really the core of the vision, and we started where the market was.